Welcome to another episode of Tubules Live. We're very lucky today to have Dr. Martin Amsel and Sally Chadwick with us today. Martin and Sally have been working together for over 30 years and have developed a four-handed dynamic dentistry approach. And this is both relevant for nurses and dentists. They've completely rethought the way they design their surgery, taking ergonomics into account, and they've been teaching this both in the UK and worldwide. Sally and Martin have been working in a practice in Oxfordshire for over 40 years, a practice which Martin established with his partner, Peter Wilkins. I'm sure we'll all benefit from what they have to tell us today, so without further ado, I'd like to hand over the floor to Martin and Sally.
Thank you, Rena. Good evening, everybody. We're going to talk today on this video, and we're going to show you in this webinar, and we're going to show you some videos of how to sit better, see better, work better, and feel better. And I'm sure we'd all want to do that throughout our lifestyles. So, let's look at some of the bad habits that we dentists have got. This is a fairly typical position for a dentist and nurse working on the upper left quadrant. Dentists are trying to see the tooth with direct vision. Nurse can't see anything, so she has to bend down to get the water away. And I'm sure this is something that you will recognise. So, where do we get these bad habits from? Well, I think we get them from dental school, really. Because in dental school, you don't usually work with a nurse. You have to decide how you're going to work, so you'll have to sit at 12 o'clock and so on and so forth. So you pick the first bad habit up there, and we'll identify this a little bit more in the video. Then you go on to your VT or your FD course now, and the same thing applies because the surgeries are designed in that particular way. Then you go on to your associate job, the same thing applies because the surgery's been there. And then you might get your own practice, and it's only at that point that you might decide to do a little bit of a change. So you've got your bad habits, and we've also got the problems of dentistry, and these problems of dentistry are the same the world over. Sally and I have been lecturing all over the world, especially in Eastern Europe. Everybody, every dentist, every nurse has exactly the same problems. What are these problems? Well, first one is you can't see very much. And the mouth's a difficult place, isn't it? It's dark, there's saliva, there's soft tissues in the way, you've got difficult patients, they're nervous, and the same thing applies for nurses, in fact.
Yes, the knock-on effect you get is the dentist trying to see what they're doing, and so dominating with their head and their hands and their shoulders and arms and feet, and meaning that the nurse then has to kind of limbo around them to try and do her work.
And the other problem is, of course, the soft tissues that get in the way. And what we're going to establish today is that dentists do not need to be the control freak of holding all the soft tissues out the way. In fact, your nurse can do it for you. So, here's the problem for our nurses.
This is a classic position where the dentist trying to do his work by direct vision because he doesn't want to use the mirror, it's very hard to use, and the poor nurse having to either lean over to see in the mouth or stand up because that's the only way she gets some vision into the mouth.
The other thing we see with young dentists especially is this sort of grip for the lower left. You grab the head so that the head doesn't move. And this is a horrible position for patients, and you're trying to keep the tongue out the way at the same time. Life can be so much easier, and hopefully through these videos we'll show you. We do have to protect the soft tissues for obvious reasons, and what I'm going to establish is who is in charge of protecting the soft tissues. And we're going to hopefully establish for you that the nurse can do it probably 70% of the time, and the dentist will do it 30% of the time. Not 100%. But let's have a little sit back and think, because I think we dentists do an excellent job for our patients. I think we're a wonderful profession. But I think at what cost to ourselves? This is the problem long term. We have a lot of musculoskeletal problems in the dental profession, both for hygienists, for dentists, and there isn't a lot of evidence out there for nurses, but when we ask nurses, they have it as well. And the official stuff is about 65% of dentists worldwide have bad backs in some form or other. Usually it's cervical, neck or shoulder, or it's lumbar down here, usually L4-5 or L5-S1. So why do we do this? We're working in very small areas of work. We often sit in very inflexible postures and for a long period of time, so we have static postures. We strain to see things in the mouth. It is very difficult to see the upper left 7, the upper left 8. Nobody's going to deny that. Where do we put our instruments? We're going to establish where we should put our instruments. And why don't we use the mirror for upper teeth? It's difficult. Water gets on it, and so on and so forth. So all of this is contributing to our problems. And it's a bit like sitting in a car. If you sit in a car, you notice the posture here, the skeleton, you've got the knees higher than the hips. That's why when you get out of a car, you have backache. We're sitting all the time, and this has all come about because of seated dentistry. And the human body is actually not made for sitting. Not really. It's made for standing. Obviously, we've come from all fours, but it's not. And you start having to think about your stool now, about how are you sitting on your dental stool? What sort of dental stool have you got? Has it got that sort of waterfall effect so that you can get your knees lower than your hips? The angle that your thighs should be is not at 90 degrees, which is often taught at dental school. It should be down from the from the vertical by about 110, 120 degrees. On a saddle seat, it'll be about 130 degrees. So, why do we get problems? Well, because we insist on being the control freak and doing the soft tissue retraction. We need magnification because we are straining our eyes to look at what we're doing in the mouth. Inadequate lighting. I'm going to talk about a little bit about lighting, where the light should come from. And our nurses have similar problems.
And nurses tend to really struggle because either their stools in the surgery don't go high enough, and it means that they need to stand up to see, or they haven't got a stool a lot of the time. Really, ideally for a nurse, she needs to have her stool at a good height, feet on a foot ring, and needs to sit very close to the patient. Again, a problem because dentists often tend to dominate sitting around the patient and the nurse can't get close enough. So she really needs to move herself up towards the patient's shoulder to be able to aspirate and help with soft tissue retraction as well. And generally, if a nurse can go into the mouth first, she can get herself into a good position. That will then enhance how well you can work together, and then the nurse comes out of the mouth last.
That's a really important one for you to remember, that if your nurse goes into the mouth first, she